Hey guys, Dr. Brandon Bupp here at Advanced Health Wellness Center, and I just really felt compelled to make this video to you guys because, man, I hear some crazy things, and for you guys out in the public, you might not even think that there were crazy things, but the truth is, it is. And so I was at Starbucks the other day, and the lady was telling me about her husband who had this back pain, and he went to the ER. And at the ER, they told him that he had a muscle problem, that this was a muscle problem, and gave him a muscle relaxer and pain medication and said, you know, see if that helps, and if it goes away, then great, and if it doesn't, then you want to call your doctor or an orthopedic surgeon or something like that. And guys, the truth is, it's crazy. So I just want to talk to you about what causes lower back pain. And sciatica, and it is never just a nerve problem, it's never just a muscle problem, and it is never a bone problem. It is all three of those things, always. And so I'm just going to use this little model. Hopefully you can see this, but here we have a disc, which y'all have heard about disc problems. We have a vertebrae, which is the spinal bone, and then we have a disc below it. And then we have the vertebrae again below that. This little yellow thing is a spinal nerve. And in the human body, this is actually significantly more complicated. But just to simplify what happens here, throughout our lives, we have different stressors that impact spinal function. Okay? So the first major stressor of life is actually the birth process. So the body is squeezed through a hole that is smaller than itself. The skull actually collapses, and then it expands once it gets through the birth canal. But there's on average in the United States about 60 pounds of stress used to pull the baby out of either the birth canal or in worse situations, C-sections where they're using forceps or vacuum extraction. So that's the first major stressor. But then we have slips, falls, car accidents, sports injuries. OSHA says that the average teenager has had 1,000 traumas in their life. And we're not talking about major traumas, we're talking about those things, you know, where they fall down the steps. My nephew fell down the steps yesterday. Or slipped on the ice, or, you know, went up for a layup in basketball and landed on their butt. All of these things accumulate. And maybe the worst thing that happens of all is that we get put into a desk at 6 years old, into a seat. And so the spine was not made to be in this forward flex position for long periods of time. So now I show you on this sucker, this full spine, but what happens when we're in this forward flex position for long periods of time is that gravity starts having a more significant impact on us. And it starts to compress the disc. And if that happens for a long enough period of time, it causes a weakness. Okay? That loss of position also creates additional stress, strain, and tension on the muscles, ligaments, and tendons that are connected to all of these vertebrae, and that is actually what holds us in an upright position. But those things get damaged, deformed, stretched, like a sock that was overly stretched, and that creates a weakness in this spinal motion unit that we were just talking about. So then a person goes and they go to bend over and pick up a plastic fork or a piece of paper, and their back went out. Nothing went out. What happened was the joint became overly irritated. Like it was already unstable. It was the straw that broke the camel's back, pushed it over the edge, and it's almost like a sprained ankle without having to twist it. But this disc or the joint, wherever, gets irritated and inflamed. The disc swells up. It irritates the surrounding neurology. The muscles, ligaments, and tendons clamp down because of it, because they're trying to protect the neurology in the joint. So the muscle spasm, the muscle issue, is actually a protective mechanism of the spine that was built up over many, many years, usually, unless it's a traumatic injury like a car accident or a fall from a height or something like that. But guys, it doesn't make any sense to take care of a biomechanical problem with medications, because that is not the cause of the issue. The cause of the issue is bad biomechanics. So we have to get in there, evaluate the spine specifically, find out where these joints are not working, how they're not working properly, and then come up with a corrective care plan, a restorative health plan that gets the biomechanics back in order, so that we take stress off of the nervous system, the muscles can go back to a relaxed, normal state of ease or tone, and we restore function to the spine. And guys, we do it every day, all day long. We're really good at it. You do not have to mask these things with medications, with pain medications, and with muscle relaxers, and hope for the best outcome. We know what the outcome is if we take care of this thing, and it's just madness to me that the ER doctor doesn't say, go see your chiropractor. The research says that it is the most effective thing for lower back pain. And it really truly is, and it's really not that difficult of a process. It does take time. It does take some specific work. You do have to go to a place that is going to take care of you well, but the fact is our results are really, really good, and we are not managing symptoms. We're actually correcting the problem, so 5 years from now it doesn't happen again, or 2 months from now it doesn't happen again. It just doesn't make sense. So guys, please, if you know somebody that has neck pain, back pain, sciatica, carpal tunnel, send them to our office, or send them to an office like ours, so that we can try to figure out where the problem is coming from and restore normal function to the spine and to the joint, so the problem doesn't continue to exist. The truth is, the answer is there. We just got to find the cause of the problem. We can get it corrected and live a healthy life and go back to our normal function. So hopefully that's helpful. I feel good about getting that off my chest. If you have any questions, please email us, call us. We're open to you. And that's it. So otherwise, have a great night.